Salam and good evening. Breaking news. We are from Group 9 and we have chosen our group assignment topic, which is depression in the community of Malaysia during third wave COVID-19 pandemic. We have chosen this topic to learn more about the citizens in Malaysia facing depression. Our group had collected the data from the published report link on my right about the statistics and findings of the topic chosen. Our main objectives are to explore the association between COVID-19 and mental health and to study and examine depression in the community of Malaysia during third wave of COVID-19 pandemic. From this report, we are able to categorize the level of depression, gender, residency, marital status, occupational status, educational status, and family income. We are performing the data in categorical data and displaying the 7 data into bar chart, side-by-side bar chart, and donut chart.
The bar chart above represent the level of depression after COVID-19. The lowest level is no depression, which is 12.3%, followed by mild depression, which is 18.7%. Thirdly is moderate, which is 21.2%. Fourthly, moderately severe, which is 22.7%. Lastly is severe level, which is 25.1%. The side-by-side bar chart above is categorical data, which represent the level of depression after COVID-19. As we can see, the lowest percentage of students do not get depression, and the highest is students who get severe depression. For unemployed person, the lowest percentage is the person who does not have depression, and the highest is severe depression. Thirdly is a person who work part-time. The lowest is people who do not have depression, and the highest stage is the moderate stage. For full-time worker, the lowest stage is the same, but the highest stage is mild depression.
The contingency table showing the percentage and frequency for the depression in Malaysian population by the level of depression and gender. The donut chart above shows the percentage of depression in Malaysian population. Several level of depression has the highest percentage, which is 12.43% male and 29.5% female. Meanwhile, none is the least percentage, which is 19.90% male and 9.7% female. Moderate severe level of depression is considered as the second highest percentage, with 21.64% male and 23% female, followed by moderate level with 21.90% male and 21% female.
The side-by-side bar chart is to present a categorical data for marital status of respondent. State there are 4 categories of marital status and the level symptom of depression by respondent. In the merit category, the highest level is the moderate symptom with a 32.8% and the lowest level is moderately severe symptom with 10.2%. In the single category, the highest level is the severe symptom with 26.5% and non-symptom of depression at the lowest rate 10.7%. In the divorce category, the highest level is the mild symptom with a 33.3% and the lowest rate is 8.3% as the severe symptom of depression. Last category is the widow. The highest rate is 37.8%, which is the severe symptom, and the moderate symptom as the lowest rate with a 8.1%. To conclude, we can see that the widow respondents suffer more than others category due to a grief of loss during or after a disaster or traumatic event. The side-by-side bar chart is represent a categorical data for residency of respondent. State there are 2 categories of residency and the symptom level of depression by respondent. The data show that the highest symptom of urban residency is a moderate symptom, which is 21.9%, and the lowest rate is non-symptom of depression with 12.7%. In rural residency, the highest level is a mild symptom with 23.7%, and the lowest level is non-symptom of depression with 10.2%. We can conclude that urban residency perceives more negative impact in parallel with increased social support compared to rural residency.
So, moving on to the next cause of depression in Malaysian population during the third wave of COVID-19 pandemic, which is family income. Okay, so family income has 3 categories, which is B40, M40, and also P20, which means this is a categorical data, hence why it is represented by a side-by-side bar chart. Okay, so this side-by-side bar chart on my left shows the depression level according to the family income during the third wave of COVID-19 pandemic. Okay, so as for the B40 group, we can see that 28.7% of them have severe depression, 23.2% of them have moderately severe depression, 21.7% of them have moderate depression, 17.1% of them have mild depression, and only 9.3% of them are not affected during the third wave of COVID-19 pandemic. On the other hand, as for the M40 group, most of them have moderately severe depression, compared to B40 and T20 group. Lastly, most of the T20 group have none of the depression symptoms compared to B40 and also M40 group. As a whole, we can conclude that B40 group have the highest level of depression during the third wave of COVID-19 pandemic. Okay, this is due to the high cost of living that still needs to be paid even though they are only earning less than 4,849 ringgit of income.
Next is a side-by-side chart representing depression levels amongst nations during the third wave of COVID-19. The chart indicates that there are 3 distinct levels of depression, which are non-depressed, mild and moderate, along with other 5 different categories of educational status. The highest proportion was 25% with a mild level of depression in non-formal education. Following it is primary category, which has 10% values for both mild and moderate levels. As for secondary category of education, it is shown that moderate level has the highest record of 17.6% and none is taken as the lowest by 8.5%. Besides, post-secondary education conveys that moderate level is again leading with the highest percentage of 21.1%, mild with 16.9%, and non-depressed with 10.6%. Lastly, at higher education, Malaysians with moderate levels of depression is recorded by 22.3%, mild level with 19.9%, and non-affected with 14.20%.
As a conclusion, during the third wave of COVID-19 pandemic, almost 3/4 of the participants suffered from depression. Predictors of depression included female respondents, young single student, domestic violence, and people who maintain regular exercise. Immediate interventions, including community counseling, programs, institutional campaigns, awareness through TV, and social media, can be implemented to reduce the severity of depression. It is recommended to bring forth psychiatric and psychological support specifically to the female gender. Thank you.